Hi, it's Dr. Raymond and welcome to my YouTube channel. Today is Wednesday Wellness. So we're going to be discussing today and over the next 4 weeks diabetes. So diabetes is a topic that is so near and dear to my heart. It's one of the most common chronic, meaning it's long-term diseases that we see in clinic. And if not managed properly, patients can suffer all types of adverse effects. The American Diabetic Association states that in 2015, approximately 30 million people had a diagnosis of diabetes. Approximately 84 million had a diagnosis of prediabetes, and diabetes was the 7th leading cause of death among Americans in 2015. So all throughout medical school and residency, in both the hospital setting and the clinic, I would see patients suffer all types of complications from diabetes that wasn't properly controlled, including nerve damage resulting in severe leg pain, poor healing wounds, ultimately leading to amputations of the limb, kidney disease, sometimes resulting in kidney failure, requiring dialysis, vision loss, heart disease, and even premature death. So one of the things that I've noticed is that patients really have a hard time grasping the basics of diabetes. And if you don't understand your disease, it's very difficult to improve your overall health. Physicians can prescribe medicine, but with diabetes, patients have a vital role to play in making sure that it's properly managed. And if you don't understand, it's difficult to play your role. So my job is to prescribe medicines, but also to give you the tools and the knowledge so that you can enhance your health. Knowledge is power. So with that being said, we'll get right into the topic. So diabetes is a metabolic disorder resulting in high glucose or sugar levels, which is a condition called hyperglycemia. And it's not just a one-time thing, it's persistently elevated sugar levels. In its most basic definition, diabetes is a disease where the body can't properly process the sugar that you eat. There are 2 types of diabetes, type 1 and type 2. But before we get into the different types of diabetes, I think it's important to talk a little bit about nutrition, because I feel that patients don't really understand that. And if you don't understand the nutrition aspect, it's very difficult to discuss the disease process and to understand your role that you have to play in managing your diabetes. So all the food that we eat consists of 3 types of what we call macronutrients: fat, protein, and carbohydrates. Carbohydrates can then be broken up into 3 types: fiber, starch, and sugars. Fiber is the part of undigested plant foods that we eat that helps aid in our gut health. Starch consists of certain vegetables like peas, potatoes, and grains such as oats, rice, and barley, and is considered a complex carbohydrate. So sugars are your simple carbohydrates, and we have 2 types of sugars. So we have single sugars or monosaccharides, which consists of glucose, fructose, which is found in fruit, and galactose. When you combine those sugars, you get double sugars or disaccharides, and that consists of maltose, sucrose, which is table sugar, and lactose, which is found in milk and other dairy products. So you know a little bit about nutrition and what diabetes is and what a carbohydrate is. So then we'll talk a little bit about anatomy. So you have an organ called the pancreas. The pancreas is located near the stomach, and its role is it has cells that release insulin. So whenever you eat food that contains a carbohydrate, Your body senses that, and in turn, the pancreas will release insulin. Insulin then works to help mobilize the glucose and sends it to all the cells in the brain and the muscle to provide energy. In diabetes, the problem is that either A, the pancreas is unable to produce insulin, or B, it's not able to produce enough insulin to meet the needs of the amount of carbohydrates that you are ingesting. So that brings us to type 1 and type 2 diabetes. So type 1 diabetes is an autoimmune disease. It's largely genetic, but can also have some environmental components. Autoimmune just means that basically the body attacks the cells of the pancreas, rendering them unable to release insulin. And when the body doesn't release insulin, it can't take up the glucose, so then it begins to break down fatty acids located in fat tissues for energy source. Type 2 diabetes and type 1 diabetes is typically diagnosed in childhood or in adolescence. Type 2 diabetes also has a genetic component, but largely it's environmental, with the greatest risk factors for developing diabetes being obesity, lack of physical activity, and a poor diet. So in type 2 diabetes, the pancreas produces insulin. However, given the poor diet and the obesity, there comes a point when the body can no longer produce enough insulin to keep up with the amount of carbohydrates that you're eating, and results in the persistent hyperglycemia that we talked about earlier, where the glucose levels are constantly elevated. So now we know the difference between type 1 and type 2 diabetes, and type 2 diabetes is typically diagnosed in adulthood. But given the prevalence of childhood obesity, we're seeing it in younger ages now. And then I'll talk a little bit about prediabetes. So prediabetes is where you have elevated glucose levels, but they are not yet high enough to be classified as diabetes. And in majority of the patients that have prediabetes, they have the risk factors that I talked about: the obesity, the lack of exercise, and the poor diet. The thing with prediabetes is, though, a lot of patients have the diagnosis of prediabetes long before they're actually diagnosed with diabetes. So the diagnosis of prediabetes is a time to really change up your diet and your lifestyle habits. Evidence shows that even a modest decrease in your weight, like 10 to 15 pounds, can help prevent the onset of diabetes. So how do we diagnose diabetes? So diabetes can be diagnosed by a simple lab test done in your physician's office. Typically we do it with 3 different types of tests. So we can check your fasting glucose, meaning that for about an 8 period or longer period of time you have not eaten. We draw your labs, and if you have a glucose level of 126 or higher at least twice, then you have a diagnosis of diabetes. We can also check something called the hemoglobin A1c. The hemoglobin A1c can be done with a finger stick in the office or with labs being drawn. And it's just an average of the glucose levels over the past 3 months. So with hemoglobin A1c, if you have a number that's 6.5% and higher, you have a diagnosis of diabetes. The last test is similar to the first, except you do not have to be fasting. It's what they just call a random glucose level. And if you have a random glucose level of 200 or more, and you have symptoms such as increased urination, increased hunger, and increased thirst, that classifies as a diagnosis of diabetes, and no further testing needs to be done. You will be treated for diabetes. We talked a little bit about prediabetes. So a diagnosis of prediabetes is a fasting glucose between 100 and 125. and a hemoglobin A1c between 5.7 and 6.4. So I hope this discussion kind of helped you better understand the disease process, what causes it, and now you have a little bit of background of nutrition information. Next week we are going to talk a little bit more about how you manage diabetes, including diet, and we'll talk about treatment options, including medications such as oral medications that you take by mouth and insulin. So I hope you join me next week for Wednesday Wellness, and I will see you soon.